Hi everyone, this is Dan Bort, presenting to you a case on lumbar and hip. So my patient was a 34-year-old male, self-employed locksmith. I checked him out June 20th this year. He's an active guy, likes to be outside, and used to be a football player back in high school. He came in for a referral for a herniated disc, and his chief complaint is right low back pain, um, as well as right hip pain with symptoms down the leg. His symptoms started in 2005, so he's had this before, but it's gotten worse recently in the past 2 months after the patient was sitting in church for 2 hours. So he has low fear, and his photo score is 36. So here's the body diagram. We've already had a chance to look at this. P1 would be right low back pain. P2 is right hip and buttocks pain, as well as there's a typo there. So P down here, this should be P3, and that is the pain and tingling numbness down the leg. Okay, so we've all had a chance to consider all the structures in the area. Here's my list, so take a chance if you want and read it over. Okay, so my early hypothesis pre-interview primary hypothesis was disc herniation, just based on the fact that that's what the referral was, and there was positive imaging for it. And you can see my secondary list below. Take a look at that. Okay, aggravating factors. I'm not going to go through all these just because they're all kind of the same, but for P1, he was very sensitive when I pressed on his on the right side of his spine, around L4, L5. Very sensitive and irritable. So for the most of his easing factors were the same. If he laid flat, his pain dropped fairly quickly, and the most uncomfortable position was sitting in a chair. Okay. Normal sleep pattern. He's had these symptoms for 2 months, like I said before. We already went over his mechanism of injury. He stated that he was getting worse overall, and that's in regards to just pain and function. He's having a hard time at work, completing a full day of work. And let's see, so he had a lumbar discectomy. I believe he said it was L5S1 back in 2005. Okay, fairly healthy guy, when all things are considered. No comorbidities. He was positive on the depression screen, and had high fear as well. Whoops. Sorry about that. Okay. And like I said, he had an MRI about a month ago that showed a positive L5S1 disc bulge. So take a chance, take a pause, and go ahead and answer these questions on your own. Okay. Now moving on to the physical exam. He didn't have any precautions or contraindications. His posture looked pretty good. Didn't see any lateral deviations or anything. He seemed like a healthy guy overall. His biggest, as far as functional movement signs, bending forward was the most painful. So we cleared hips and knees in the examination quickly. Okay, and now for the neurological examination, he had negative upper motor neuron lesion tests bilaterally, and he had diminished reflexes on his right side. Okay. So for the muscle test, he was also a little weaker on his right side. That's basically the summary of this slide. And then his sensation was normal all around. Okay, so he had some limitations in his lumbar active range of motion here, as well as some pain with the lumbar test. Flexion was pretty painful for him, and extension was as well. Obviously, right side bending was also moderately painful. And then I performed a quadrant test. I did this one actually in sitting, and the right side produced pain as well as P1 and P2. Okay, so kind of going along with the functional stuff I mentioned before, the patient had pain, specifically P1 and P2 during a squat. He had a normal gait, good balance. He could walk on his toes and his heels easily. During palpation, he had pain with unilateral PAs of L4, L5. That's that sensitive area I mentioned before. Sorry about this. Okay. And like I mentioned before, it was very painful, immediate, and intense. Overall, his spine was hypomobile, and he had some hamstring tightness bilaterally. Okay, so special tests. So straight leg raise was negative on the left side, which is interesting because you always want to think about a cross straight leg raise, but it was negative here. And a regular straight leg raise was positive for reproduction of P2 on the right side. And then slump was positive on the left side for P2 reproduction, and then negative on the right. And then, so I did kind of a McKenzie directional preference exam as well, checking out extension and flexion, and both ways, after about 10 repetitions, peripheralized his pain. And I'm mostly talking about his hip pain. Didn't really do anything for P1. Okay. And then the last kind of finding here is he had a positive scour on the left side, which aggravated P2. So let's go ahead and take another pause here and go ahead and answer these questions and then move on. Oh wait, that's it. Sorry. Anyways, look forward to talking to you guys on Thursday. Post all your questions for me, and I'll be happy to answer them.